Hi, my name is Dr. Dev. Today we're going to talk about night terrors. If you're one of those who've been suddenly woken up by your partner lying next to you, screaming and shouting, this may well be a night terror. Keep watching and we'll tell you how to fix it. Welcome back, everybody. This is Sleep Talk with Dr. Dev and my sleep assistant, Buddy. How's it going? Hey? Well, you're half asleep as well. Today we're going to talk about night terrors. Very, very common condition in sleep. It's called a parasomnia. In other words, abnormal behaviour whilst you're asleep. It occurs in part of the sleep called non REM sleep. Essentially, there's two phases of sleep: dream sleep or REM sleep, rapid eye movement, and non REM sleep or non-dream sleep. There's different levels of depth of non-REM sleep, and night terrors, as well as something called sleepwalking, occurs in the deeper part of non-REM sleep or slow wave sleep. Now, night terrors is very common, more common in children, and we tend to grow out of it as we get older, but sometimes it does come back, and there's lots of priming factors for this. Now, night terrors is basically something where the individual bolts upright, screams the house down, and then feels as if impending doom and they're going to just collapse in a heap and then back to sleep again. But if you're that person lying next to that person, you're probably not going to get back to sleep because it's absolutely scared the living daylights out of you. The interesting thing about this non-REM parasomnia compared to something called nightmares, which occur in dream sleep, is the person with the night terrors have no recollection or very little recollection of these incidents. So if you say to that person, did you know you just screamed the house down and the neighbours kept banging on the door and saying, what's going on? And the police came. Well, the person with the night terrors is going to say, hey, are you sure? Maybe you need to see somebody. And that is the characteristic of night terrors, because it occurs in non-REM sleep. There's very little recollection, whereas in nightmares, there is a lot of recollection. It's almost like a story. They almost see the vivid imagery of it, and then they wake up feeling, oh my God, and they still have the similar feeling of impending doom and heart rate pulsing, but they have the recollection. Now, night terrors is actually not a health issue, but it's a well-being issue. And if you're having many night terror episodes in the night, it's going to affect your sleep. But the most common reason why people with night terrors come to me in my clinic is because their partner is not sleeping well and they're worried about what the neighbours are going to say. And in fact, this causes more of an anxiety effect for the person with the night terrors, because they're thinking, well, if I'm going to sleep tonight, am I going to wake the whole neighbourhood?
Will you two shut up? People are trying to sleep.
Now, many people think that this is all related to a psychiatric illness, but I have to say it's more of a physiological problem than a psychological problem, because it's related to the non-REM physiology. The key things that I look for in my clinic is trying to work out what the priming factors are and what the trigger factors are. The common priming factors are 1, sleep deprivation, and 2, busy brain from anxiety. So in sleep deprivation, if you've not slept at all one night, and then the next night you get a rebound deep sleep or non-REM sleep, you're going to spend more longer time in that deep sleep, so you can have more likelihood of having a night terror if triggered appropriately. And the other priming factor is anxiety and stress and busy brain and hyperarousal. That almost makes the non-REM sleep very jittery. That actually gets you into that night terror feeling. Now, the other thing I look for are the trigger factors, what triggers the night terrors, assuming that you're primed now. Trigger factors might include noise externally, like the garbage bin being knocked over, or the next door neighbour hooting their horn in the car, or even your partner bumping into you. So these are sort of things that I look for, priming and trigger factors, in order to try and have a strategy in place to reduce the number of night terrors they have. Now, ultimately, they might have clinical psychology input in case anxiety is a big issue, trying to reduce that cortisol and the hyperarousal state when going to sleep. But although I try and reassure them that this is not a health issue, many do opt for medication. We have tried melatonin, not quite always successful. We have used something called Clonazepam, which is a Benzodiazepine, to improve the sleep consolidation, but there are many side effects, such as the foggy headedness and the drowsiness in the morning. One thing that I have used effectively in some patients who do have anxiety and hyperarousal about their sleep, that might well be a priming factor for the night terrors, is CBD oil or Cannabidiol, and this is taken at night time. And many of my patients have had a lot of success with this regard. So if you're worried about night terrors and you're worried about affecting your partner and his or her sleep as well, go and get it checked out. Go and see your sleep doctor. That person might arrange for a sleep test to see how well you're sleeping. Go and understand whether it is anxiety that's driving this. And there'll be various strategies in place that we can reduce the amount of night terrors are happening and occurring. Remember, night terrors is not a health issue. It's a well-being issue. It's a physiological condition. It's not a psychiatric condition. I hope that's been reassuring. I will see you next time.